Today, we're unlocking the secrets of immunosuppressants, how they work, where they work, and how they can sometimes backfire. The immune system is your body's defense squad. The innate immune system acts fast and blindly, while the adaptive immune system uses specialized T and B lymphocytes to recognize and attack threats. T-cell activation needs three signals: recognizing the enemy, getting the go-ahead from co-stimulatory molecules, responding to cytokines like interleukin, IL-2, to grow and attack. Immunosuppressants block these steps, and that's how they work. Calcineurin inhibitors like Tacrolimus and Cyclosporine block calcineurin, which stops NFAT from triggering IL-2 production. Without IL-2, T cells don't multiply, so your immune army stays quiet. But calcineurin is also crucial for kidney blood flow. Blocking it leads to nephrotoxicity or kidney damage. It also causes vasoconstriction, leading to high blood pressure. And because neurons rely on calcium signaling, patients can experience tremors, headaches, or even seizures. Costimulation blockers like Abatacept and Belatacept prevent signal 2 by blocking the handshake between CD28 and B7. No handshake, no T-cell activation. Since T-cells aren't fully activated, your body can't mount a strong immune response. That means increased infections, reactivation of TB, and worsening COPD. Minor effects like headaches or nausea might come from changes in cytokine balance. mTOR inhibitors like Sirolimus block cell cycle progression in T cells even after activation. It's like pulling the brakes after starting the car. Since mTOR controls cell growth, blocking it affects more than just T cells. Delayed wound healing happens because skin cells can't regenerate. It disrupts lipid metabolism, causing high cholesterol. And the anti-proliferative effects can lead to mouth ulcers and low blood counts. Antimetabolites like Azathioprine and Mycophenolate stop DNA replication in rapidly dividing cells, like T and B cells. But other fast-dividing cells are also hit. Bone marrow suppression causes anemia, low white blood cells, and low platelets. GI side effects like nausea and diarrhea happen because gut lining cells die off. Azathioprine can also harm the liver due to its toxic breakdown products. Corticosteroids like Prednisone bind to intracellular receptors and alter gene expression, turning off inflammation and turning on suppression. These hormones affect nearly every system. They increase blood sugar by boosting gluconeogenesis. They cause fat redistribution, leading to moon face and buffalo hump. Osteoporosis comes from decreased bone formation, and mood swings or insomnia happen due to effects on brain chemistry. Antibodies are precision-guided immunosuppressants. ATG wipes out multiple T-cell populations. Muremimab CD3 targets CD3 on T cells. Basiliximab blocks IL-2 receptors, CD20 and B cells for Rituximab medication. The more aggressive the target, the bigger the risks. Cytokine release syndrome happens when T cells die suddenly, spilling cytokines. Infusion reactions are due to foreign proteins triggering immune responses. And drugs like Rituximab can cause B cell depletion, leading to low antibody levels and recurrent infections. Immunosuppressants are life-saving, but the price of suppressing immunity is, well, suppressed immunity. The key is precision. Target just enough of the immune system without tipping the balance too far. Hit like, subscribe, and share if this helped you break down the big picture of immunosuppressants.